Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being.
Hi, and welcome to Redefining Medicine. I have the honor and the privilege of interviewing Dr. Michael Goran today, who is the expert on what we're doing to our brains and our children's brains with sugar. He's also the author of the book Sugar Proof, and he has just given a lecture at the most wonderful integration of wellness, prevention, functional medicine, where we finally brought in children as part of it. And Dr. Goran, thank you so much for joining us.
It's a pleasure.
I know you have an NIH grant, and what's the research you're doing on with that in that grant?
Right, I actually have several NIH grants.
Tell me about all of them.
Yeah. So I think the one that was mentioned was a new center that we just got funded. It's called the Southern California Center for Latino Health. It's actually a new initiative from NIH based on a congressional mandate to do more research on ethnic disparities in chronic disease, to try and understand why, in our case, why Latinos in Southern California are more vulnerable to things like obesity, type 2 diabetes, fatty liver disease, what's causing that, both from a social determinants of health, environment, diet, and what we can do about it. Like how do we design specific interventions that are tailored to address cultural preferences and are more likely to succeed?
So that's very interesting. So tell me about what you found, what your passion about what we're doing with the sugar and how it's affecting our children's brains.
Yeah, so how it started was, we showed many years ago in Los Angeles this tremendous economic disparity in obesity. So children who lived in low-income neighborhoods were 8 times more likely to be overweight and obese than kids who lived in affluent neighborhoods. And that this disparity started early in life and was more pronounced in Latinos. And that one of the main driving factors that we've seen in children and adults, not just for obesity, but also for type 2 diabetes and fatty liver disease, a brand new disease, didn't have it 10 years ago. And a kind of a common contributing factor is high sugar in a diet. One of the highest sources of excess sugar in a diet is sugary beverages. So our research is all about how sugars affect growing kids, how that affects their long-term life and health and well-being. And today I talked about specifically the brain, which is just part of the story, but that fitted with the theme of the conference because sugars do affect the brain in many, many ways, from memory, ability to concentrate, and studies have also shown that kids who consume more sugar just don't do as well on standardized tests.
And how are we going to change that?
Well, so my book, Sugar Proof, really the first half is all about the science of all that I just talked about, but the second half is really, okay, what do we do? What do we do? Mm-hmm. How do we do that? And so, because not just kids, but us adults too, we're very dependent on sugar. Sweetness sells. It's in all 70% of processed foods contain sugars. And so it's working with families to use family-based strategies, like, for example, working with kids at breakfast to reduce sugar at breakfast through, instead of juice, having water, moving away from sugary cereals to more savory type breakfasts. You don't have to add jam on toast or syrup on pancakes. You can add other stuff, so the more we can get the sugars out and get more protein and fiber in, the better we'll all be. So Number of different strategies. The biggest culprit is liquid sugar, which in kids could be sugary beverages or apple juice, fruit juice. And those, apple juice sounds healthy, orange juice sounds healthy, and it's okay once in a while, but the sugar adds up.
What about the pediatricians? What about the first line of the provider, right? The ones who take care of the patient, the ones that should be talking about diet and should not just be doing your routine and monthly physical, whatever it is, how much you weigh and how you're doing. What about diet? What about bringing in nutritionists?
Yeah.
What are your thoughts on that?
I think that's another part of the story. I think we talk about this in the book, that I think pediatricians are busy, moms are busy. It's not easy. I think we're focused too much on weight. It's not just about looking out for excess weight on the growth charts. We have to kind of look a bit deeper, look under the hood. It's not just about how nice your car looks. It's about how well it performs.
Right.
And some of the routine tests that we do in adults are harder in children. Like, when I go for my annual screen, I get blood drawn and have my lipids checked and my blood glucose. And that is more challenging in kids, but the technology is changing to be able to do that less invasively.
Yeah, but you know what? By then, it's already too late.
It might be too late.
And I think what you're talking about, which is so amazing and so important for all of us to understand, is we're starting with children. And
right.
If you do it right with the children, you may not need to look under the hood that far in adults.
Yeah, but what I'm saying is it's also important to look under the hood in kids.
Of course, I know, I get that, and I think it's important for the doctors, the providers to understand the importance that, I know we're all busy, and I think that that's been an excuse for many years,
Yep.
that we're all busy, we're seeing volumes of patients, but the thing is, one patient saved at a time makes a big difference. So you're talking about the NIH grant, and about looking at the Latino population, which is more likely to suffer the consequences of too much sugar in their diet, and you said liquid diet part, what they're drinking. And is that something that you see mostly in a lower socioeconomic level people? And is it because they don't have access, or is it because they're not told that it's better to drink water?
I think it's probably a combination of all those factors. I mean, as I mentioned, there's a huge economic disparity. There's food deserts. Healthy food there's a belief that healthy food is more expensive. So, for example, one of the projects in our center is doing a study that will design a meal plan for Latino households that meet the dietary guidelines, that meet the sustainability guidelines as well, and can be purchased based on SNAP dollars. And the study will purchase all those foods for families with recipes and meal plans that are, again, specifically tailored to Latino households. And it's a controlled study because we want to show that if you can obtain those foods and cook them and eat them for a couple of months, that your health will improve. So that's one of the studies that we're doing within that center.
That's a great study. And how many people will it involve?
That'll be 200 families, 200
So that's
Latino
significant.
families, with at least 4 people per household.
So that's very significant. Yeah, and I think culturally speaking, it's a problem that has been evolving, and we're watching it, and we have to stop it.
Yeah.
And I think your work is amazing, and it's wonderful, and it'll help. And I think the more it goes out, the better.
Thank you.
And thank you so much for coming and sharing with us the information.
Oh, my pleasure.